Okay, good evening to everyone. Today to Public Health Matters. And so. And last week we talked about rights of patients. Ayarefo anase nipa awko hospital kohwe omoho eyade. And so but we are taking a little bit different angle, but a continuation of what we did last week. I'll say hospital practices, experiences, and healthcare system in Ghana that affect patients. Our target is people and people. So health issues that affect people. And we are going to have our brothers and sisters. Now, as a CA, we have Mrs. Adeyeboa, a nurse based in USA. And then we have Mr. Francis Samankwa, a master's public health student in Sweden, Gothenburg University, to be precise. Now, answer let me have a take and as a bit intro. I will brofu. So, establishing patients' rights is a step towards protecting the rights of patients. Yet, the violation of this right is common in healthcare institutions. And this is due to the presence of systemic and institutional obstacles, such as insufficient healthcare staff and inadequate purchase and maintenance of technological equipment. There is neither systemic nor structured complaint procedure at the healthcare facilities. So, usually, you will not have people complaining, making official complaint because there is lack of it. The healthcare workers cannot readily explain how complaints are handled because that system only exists on paper. Although a complaint box sometimes sits in an obscure place close to the office of an administrator, and as in the ward no hobby, it may be rusted, might not be used for years, and health staff may have observed that patients rarely complain to them. There is no systematic or structured complaint procedure, but a lot of people are complaining outside there. So that is why we are going to look at things in our hospitals, people experience complaints, and then and before I go on, ma a complaint about or say in the town of Takwa, these complaints that I'll be reading or I'll be sharing in this conversation, something empirical evidence, somebody who have done his qualitative research work and interview real people. So real people have given their, they have shared their experiences. So in the town of Takwa, located in the Ashanti gold mining region, a young woman waited for weeks, detained in the hospital, nursing her newborn baby, while her husband tried to borrow money from relatives to pay the hospital fees. The Ashanti region sits on a mountain of gold, but the local people are not benefiting from this wealth. Another one, at Tema General Hospital, outside the capital of Accra, 40 patients were detained. Some for as long as 4 months because they could not pay neither bills. They could not pay their bills. In May 2002, it might seem say, I dare not me reading, I check ekakra, but I have a reason for picking it from 2002. May 2002, local business people finally raised the money to bail them out. The detained patients, including 22 nursing mothers, 10 other adults, and 8 children. So this is from Daily Graphic, May 4th, 2022 report. Now, and some be say, and health insurance makes these things phase out, and I say free maternal care make some of these things phase out. But we are they still there? How, when these things happen, how do the health facilities manage them? Enti yenche ewo hono maybe sa mene omo line to share with us. Now you are not in Ghana. Now you are not in Ghana. May I ask you, sir, have you some experiences being there as patients? And I say, hey, bisoswa, what work either. But I may ask you to give your first introductory remarks, akakra, and sana yako topic, so ankasa. Ain't a ladies first. Maybe sa may says adeyabwa. Ama one man introductory remarks, ekakra.
Thank you. In the first place, I would like to ask, are we doing the tree or the extended or just English? Oh, yes.
Me pacho mento kasa no ekakra. But you can use any language, English or Chi.
Okay, thank you. My name is people call me Mrs. Ade, so I'll go for Mrs. Ade. I'm a nurse in US, and I lived in Ghana longer than in the US, so I have had more experience in my life.
Hello, Mrs.
Yeah.
Hello, me pacho ma me interact kakra. I say audio no, o mic no, connection so obetimi a check ya my kakra. Na yeah, call Francis, so we will come back to you. Yenua Diana, so I join here. And from Francis, we go to Diana, and by that time, Mrs. Adeyabwa might have worked on the mic now. Francis, Pepacho.
Okay, yeah. I think you were asking about experiences, right?
Yeah.
Yeah, and Timameka said, I say, one time me, I recall hospital. Sometimes me yeah exposure to work at the hospital. We call hospital. Na uko nesa ohwe say yedi obi eba emergency. Na ohwe say ne relatives no rush anyhow I say omo April ho say yedi omo de hye ne be kɔ na makɔhwɛ no, and then ohwe how a nurses no aye as a calm omo de gina ha as a hwe from home say ade na omo so do mu na so do mu until say me the opportunity we school am koye adwuma wo hospital bi and I'm a say ne ma ni bi ase afi me so bi hu ya say do bi ba pe na aye me normal ati say aha nti no I think say going forward, no, measure how sa experiences na health workers na because every day, and then we are used to it. From the patient point of view, no, one tia say the health worker, no, most of the time, so better. Nurses for need the doctors they were standing no be empower so you understand? Yeah. Going forward now, discussion go forward now, try and then bridge that the feelings of the patient and then the patient relatives to that of the health worker. No, na yeah, sure. How a bit to me, near bit to me, uncle, intimate that's it. I mean,
Yeah, that's it. Well, introductory remarks. Pacho, any you call Mrs. Diana Boateng. I'm my introductory remarks. You are near comments a day above. Pacho. Me Pacho over to me. Okay. Yep.
Okay. The last time I trained nurse both in Ghana and here in Finland. Ghana man shouldn't show up on after training, but I have saying I've been a nurse for 5 years. And then based on our discussion, hospital practices and experience, I have been both a patient in Ghana and I have also I've been a patient before. And I've also been a nurse in both sides. So I know how you feel when you see someone as to say a rudeness or unqualified or what. I've been in the hospital before being a nurse and after. So I know how some feel about it, but I say 6 and 9. Obi gina a training a obi who how a city. But we won't say 6 or you're correct. We won't say 9 you're correct. So we are both correct. That's why a discussion we na you're pensing.
Yo, yeah, that was it. Well, introductory remarks. After you ever caught me sister day above. Hey, better. Okay. Yeah, but that's it. But I think that you still have some slight issues in that. And say whilst we're going round, but you're over to me, I fix my. Okay. Yeah, that's it. So now we can go to the experiences. So if you want to write a comment, if you want to ask a question, you can write it on Facebook. And if you want to join the discussion too, there is a link under the video, live a program, you can also join and share your experience and we can all have a conversation and advise ourselves. Ansana mema share more experiences either as patient or as a health worker. I want to share one experience with you. An American nurse, Obroni, Oba Ghana, ebe a volunteer. And she shared her experience through, there's a project we call a Project Hope. So he had an eye-opening experience in Ghana. That is how she titled it. She said, during my shift, a 20-year-old female arrived in a severe respiratory distress. She was walking, but was assisted by her parents. She had a large amount of swelling to her neck and under her jaw. Several nursing students were working with me today and had never seen a patient in such extreme distress. The ENT physician came and was arranging to take her immediately to the operating theater. Unfortunately, the patient died from a blocked airway about 20 minutes after arriving. Her parents said she had been sick for several days and had been taking her to the local herbalist. They finally brought her to the hospital, but sadly, it was too late. Unfortunate is the fact that although Efia Nkwanta Regional Hospital is a very large facility, their casualty department, that is an emergency department, does not have the capability to resuscitate a person that is sick. There is no overnight physician. I asked the head nurse what they do for the patient at night, and she said the nurses treat the patients. This is one nurse at Owusu-Afriyie, US, a volunteer. This is the experience. Do you have anything to say about it? Yeah, the best or why Mami Shasi free ye about a Diana.
Okay. Her experience is really true. It's something that happens. Most of the rural areas, Owusu, for example, they do not have doctors overnight, as opposed to say big hospitals like Confanoche, the one who say your hospital be said Confanoche, doctors will work 24/7.
Yeah.
And your other one is Suntre, so a bit to say the old to very few. This is Suntre, so Mampont, these are hospitals, so they have a different system. And I have those ones are in the rural areas no. Normally no, even sometimes no, nurses kwa no nya no enumere. This obi oye auxiliary nurse. Ghana kind of pink because lack of staff, and here one of the things that happen. And during this time, people are very willing to do their work, but because of lack of staff, so my arranging is and mostly, so they also think that most of the time, no, people do not normally go there or at night. Normally daytime, no, most patients, no, it's a whole in like inpatient in one day. I said, so the experience how can she, as she said, she was in the rural area, and it's not the bigger areas. All those bigger areas, they're 24/7. When you get to a hospital, my work will become experience. I'm working was on so that I'm a student, you know. Mm-hmm. And then you have nurses 24/7 there. Obi call home at you. They be could be on standby. And if say BBC crying, they will transport you to maybe a big hospital. Maybe if say now say say those emergency surgeries no kwan yet me be but now they mini honum. So her experience is true, but it was in the rural areas. And as she said, the nurses are ready, so but again, the things are not there. To say how resuscitation and Yemeni in a bini honum. I have been this say what call baby to say it be a terrible asthma to say the big small hospitals say what every area no.
Yeah.
And no crown, they have ambulances there. If anything happens, they will take you. And I be honum, which is accessible. And see where experiences are, it's very true, but it depends on which area she's talking about. In those rural areas, no, and Yama says.
Now this American lady, no, they're not a surprise. And they say, if you Nkwanta, meaning baby, but regional hospital, or say it's a very large facility. Ain't it a crisis? And okay, we will.
If you're
Okay. All right, Francis.
Yeah, if you're quantine crasi, me, yeah, but I saw a government hospital.
I think so, yes.
And I'm not night muni because yeah, me one kakra. Okay, but with issues we know when it comes to the use of hospital supplies and you know, and I'm say responsibility in the hospital. No, so minim in Finland senior etie and in the Swedish system no so minim senior etie. But to Ghana, those aiding in no responsibility in is on the government. So it may be if the facility is a big facility, and one say be or more some basic things we can say be resuscitate and ample bags and do saying hey beer or one year then or one year be because senior yeah structure system one hospital administrators no Emma they have creditors to pay, they are running into debts because of failure where yeah insurance claim or the quad a check reimbursement no and yet 1 month in arrears it be our day a July the obenya in August naka aba flow no of income na ba every year yes anete nti etumi bo hye a bo so wani na ye ko nti the little finance na benya no the thing is you have to buy drugs, the drugs that you buy and give to the patient, the same drug goes to insurance. So it's like you get the money and then you throw to the insurance people without the money coming back. So yeah, say anytime insurance system they be a challenge, you know. So to say they be another hospitals no higher than actually. I had this experience. Akwadebia, ne stepmother, okudi someone na ne stepmother, catch and say ne papa ba, obeka ne apon. So na minim akwada no okofa am say parazone say den no onom ye say ne papa ne stepmother na say within someone ti papa na bobe catch no ambon. In fact mo ha no be catch me say omo pe NG tube say nurses wa ha no mo de to wo yi no ma twe NG tube eben because hwehwe me nneoma mu a many NG tube had nso ye emergency so immediately me call ho ward ho and I'm a lady girl no me call na say de wawu je say won keka no ho won keka mo da ho flat no the oxygen esi so na me hwe ne sa na me ra ho na me sha kwada we pa de say bibiye ne pa me na mai and then me so blame who because that time no na saa nneɛma no ɔmo nhyɛ da ngye nti ɛba free so and then looking at challenges near war in finances no me plan for hospital supplies na nneɛma na ɔmo taa yɛ yi no ɔna me taa ɛtɔ bi gu ɔpa nti eludi me but nyame nkyɛn adeɛ sɛ akwadaa no etumi live yɛ ne ho tɔ no ma ɔmo yi no de no kɔ fie from that time you know I had a different perspective to how I do my work nti with procuring of items, and I would just ask the nurses or more heads of department instead they never be here be famra. Those are a year on emergencies, they should check it for me. Now me share how I meet me a plan supplies and send you a emergency be back and yes say you need back cry a day. Some of these things it can happen. It can happen going forward or see share as a country, as a nation. Now your my health no better come so now you how I be to me and the eye even it's not easy say I go into hospital administration before let's say about 3 months 4 months let's say into usika koka baby ye reimburse usika ne mawa the hospital have to run nti no mabu ho a won say onto so ho nti me de nye mama if that is what happened it's possible say it can happen that's it.
They say no ABR the collaboration and as a communication between you and maybe the nurses and as a frontline workers no and no nema niama the right now can was a more procure no and the
Yes.
patient was suffering from whether negligence or inaction or lack of communication or whatever. You know, they say no, yeah, kono. It could be that somebody is working in a hospital somewhere in your position.
Yes.
In a similar position, they can advise themselves. You always ask the nurses, name doctors, because it's kind of time you shall.
Yes.
Okay. Yeah, that was it with this experience. Yeah,
Okay.
Okay.
All right. Okay. Thank you. Me say me kaka omo de ne no ho say unse sa crash cart no has any kind of emergency cart no enye ade bibia eye hospital ni eni ewo ho but because nim say those things should be on that emergency for example unse O2 tank no e say back also 2 e was say flashlight e was say normal selling e was say O2 sashing machine no na also tubing so also plus you have the oxygen tubing saa niema ni nyina also nti saa niema ni nyina enye only the nurse's responsibility say or making sure say also it's everybody working in the facility because we check it every shift we check it making sure say even did they have emergency or you so then you replace it nti na kwa say 10 bia no set. And say in case you use ambu bag, no what you saw, then you replace it from the central service. Central service in your baby, or field, no more field, more shiny amano bomo no niasano. Anti central service for no responsibility. No, my check is say, oh, okay, we are last week we used, or yesterday we used this internet, intimate reuse it. But me, what I've seen is say, in general, even doctors or nurses na baby way anymore. CPR no among trains actual CPR no. Your problem e ho no. Akra bi wo hokra and I say obi wo hanka say bi onwo fie. And now just say bibi wo we can prevent it because we don't know the public doesn't even know anything about CPR on top of even the healthcare people. Into only akra bi aba ho no here just to do the CPR for the person to come back around. Yes, the person don't want to do it, but the person don't know it. So these are some of the things I see because nipa bebre accident is here. You peja nkrofo peja womo de womo ko, which we could do the CPR se public in inima na ya money pana back. But who did not free ho be a only now did not free accident scene or whatever happened the nekwa satam kakra ni timi mani paniwu. But thank you sad and then right away which I can pause. We check it inside and now checking out who now would perform here. Nipana come back pa. Then you the Nipana Eco Hospital. Here betima save nipa bebre or no. These are some of the things can. 2. Uko me call Ghana recently. Terrible. Yeah, you go Hana the corner. I hear because we too no. But if you don't even say it, and so I say a continuously a caho. Me go no na me yefru ye me yasa. Nti me ko na omuma maduro ye bibia na omo die to. Me wie omo say in half tamanu maduro na wie no 2 days and I should bring stool sample. Na me say omo say but you treated me already. So if you get my stool sample after all this medication, you will see nothing is going to go negative. So you have to take the stool sample before you treat me. That way we will know at the crow a hamming. I nurse back and say, oh, you know, Sana, you had it, and I'm so okay. Me so me honey. I didn't even tell them, say if you baby crying, and I'm so. It doesn't matter, baby. The right thing should be done because Uma medress is saying I'm hot me we are. I did internet MBI, BBI, I will say negative. Oh, yeah, check your any idea before because we don't do the proper thing. Or because hospital, yes, you need of excuse me, say, or emesis or vomit, or yes, you have who take a sample, no VA, then you treat the person. Obi bahono yare who take a blood sample VA before you treat the person. But here, your system, we treat the person before we take those samples. So if you do that, all the results will be negative. And then the person will come back again with the same sickness and they give the person medication and treat again. So in case, God forbid, something happen, near the question by before. Because Okobi, a doctor says she knew her. And I near the piano, a bayari. Doctor says she knew her. Near the question by before. It's not a by before, it's the way we do our system. Nti muma ya wo Ghana mo pacho muma ya na in I point on the in-service. If we have it and we train people, then we will change our way, then we can save a lot of people. Nti me so kakra me na one thing is say Ghana no corner ye boga. They treat you different from Ghanaians. Which shouldn't be because you Ghana for na year 2 point because me back to year 9 you call no 1 year you could do because na me dware na me year aduane na I said no ye shishi na ye rush to hospital so I wasn't even worrying anything nti ye drive through hono omo hwe me ho afo ne me wo ayi na abu sense ne ma me wo he na me si me nie na omo try fa no ko ogina ba bi o nurse ne fa no ko to let me see how do I go because minimum hospital where you come and say this is not a grassy. Now me see minimum system hey na me fan was it bed in this one fan to then me didn't go to nobody was coming so I made the by and I'm saying can somebody come in to attend to my son? I'll say then a next back by then the different nurse came no say I cry na me true ni din ye bibia. Or true you be saying where was the child born? All this one nobody came to attend to us. I'm so in US. Oh, then they started rushing in. I'm telling you this. So after that, I fought with them. I said, oh, so those of us who were born in Ghana, so we are nothing, right? Now you saw that he was born in US. So look at how many people just came in to attend to him. Right now, you call the doctor to attend to him. So you are telling me those born in Ghana, we are nothing. And he's like, oh no, you know, those who are born in abroad, I'm so, excuse me. So I have stopped attending to my son and then fighting with them about how to take care with everybody at the same perspective. These are things we have to change, and it all goes in the hand of in-service training people every month or every 3 months. That's my option.
Okay. Yeah, that was it. Yenua baby so I joining us Jessica Sewa Boateng. So I join us and check your bema on also time. But okay assembly say in case of accident a bar the way you see a handle or mono. People don't know CPR now they how can they know? How will they know? They say yeah, we are just doing this, passing the information around because these experiences now patients have rights and they have responsibilities as well.
Yeah.
You know, over to me the kakrabia akaho and sana yamayenu amoso atwaso. Do you have something to share with us? How can they know?
CPR has to be started from school and then from workplaces. It doesn't matter say who your nurse and Kurano kids who are school, they know how to perform CPR. And to say, baby, na fan say, Hano Nambia, we nurse, you try to go with something in case of emergency, you perform whatever. Nti no wo to kwan wo nim say bibi sa besi nti one prepare. Nti no yet try say you educate nkrofo say wo kono obi a so obi a na wo nukunu kwan na you don't need that plastic thing to cover the mouth and I will buy. You can do that. But if I say outside that's where you need those plastic things to do. And you educate people, and each car, you have to have something in. So what about the car A2 all these things has to be in. All the emergency stuff has to be in the car. So whoever has been trained and whoever knows it, just pick it and do it for people. Once he has the other people checking those who has pause and all that thing. Until school or a jumafo to nim na training or to perform no minimum. I think say we could do a lot. And then if they want somebody to train them as CPR, then they have somebody say in Ghana me you feel mudi responsible for training people to know how to perform CPR. Red Cross, thank you, sis. And then all that. And young reaching out to them, then they can start go to school, they can schools, hospitals, everywhere, and they do it.
Okay.
To me, it will help.
If I can add something up.
Yeah, all right.
Yeah. First aid, it should be a general information for everyone. Because it starts from say adi kakra twa wo ye adi o kitchen. Something big to say a jersey na should be. And even say because say no okaye minya ha wo say niam kinkiti bo ha hia obi I check em omo twe no maso ni ti atwe no enti eno kura ti mi ebu ni spinal ebi asida
yeah
I say nipa ni spinal cord enso nya accident na kun no omo twe no muso ni ti ana ye twi kan be shi so mo twe lady ni wie ye no say ni moot na eno no oma say ni spinal cord went me and survival beam enti these things are their first aid, their something it should be a general information. It's tough from say a crack kete. And it's all fear na the chawa. Once a 2 hours, say where the free vein and I say free atrium until was set me a home baby. To something big set will be a jar asho. No so no only person what to so no a bemana day is so oxygen on my bed a bemana shiny more anchor or moon and who for ma into the end yes son say first aid dear and cow a crackety cra and I info school to set me to set obia woo school be I'll move jane ma the now for and we can enough for say be any we are first aid na kebi ani pano kra no yende ka bibi sai nkoso but ye jan omunim hwe Ghana ani mas owo mboni suo mumfa ejenne fa nanim ni aboni punu and just enough yes when someone is dying now the first 1 to 10 minutes or 5 to 10 minutes is the vital point so be wo benya nkon ne hia nipa no bibia hye na oye na mu se boni nsuo ni kwa ko gudi hwiri mama akochoki na ebi obeba no na nsuo na ende achoki no obi ba mo de ne ko hospital wenya stroke upagya ne nan a na teseka blood rush to the brain ye gedere ba no ye not nasty se obi efuna de dan o ti akonyem blood ne say the air call wrong place tini na ya ade a enya say ye nurses for and say doctors for and now we no work in hospital mami e wo jom akro wo school obi anima ni enim ye writer eno kra mana ye den akokama amai
yeah that was it be brave say what line on that utie ya this is a public health matters what matters in our conversations ne say ye person niema e affect a lot of people ewo ye memo na de mo boss yi in arbitrary schools every primary even from daycare kosi university they have fire drills They have drills from first aid. And you know, a cracket to a crane, say, okay, say Jabby say, shall see it say, number say no, say me free. And I will fear na say, Bibi say a trap me, mammy, and I say, even cry me, mammy, asthmatic. Now, when you attack, we have been having these drills, even as nurses, cry as our healthcare professionals, no, firemen, no, ever from time to time. Every term, beyond you have courses, universities. So, Adian Kebe Katre say ambulances are Omodiako district beyond say, and at least every week beyond be on my map say JSSB, primary school B, or morning crown back drill kakra. That is where we start from. Yeah, Kromugana, Yenyandru America. Yenyandru Finland, Yenyandru Sweden. So we will start from somewhere in kakra. Now said yes, can people wounds from car accident get even more infected till even say your spinal no so yeah. Oh, Edru term yeah, but glad we are having this conversation and people who will have way. Jessica and Kamiba, Jessica so but Jessica me pacho say utie me ubetimi asaya aba. Yebeko Francis so or something to add.
Yeah. Me nua emma no asepa. Omo akasa. Ebi. You see, sa no ma ye nyina ebitumi happen na it'll happen at the policy level, the policy formulation level. So it will interest you to know say obitumi akobe bi a bokona common pipe nketo ni bi na pipe nsu e be buagu pa ego I just ask myself say inti nkwada na ko school no and say me nya me education in Ghana no itinka throughout my education ke chere me basic plumbing techniques bi a enka sa nka metimi eden metimi a fix it. So ebia na ye kan you but sa ade we say nurse ni no ntimi enkoye doctor ni no ntimi enkoye is at the policy level omo ye no policy akwada bia obewie akwada bia wa ko school die at least JSS die or sa de bu ho a otimi he den ehu about this first aid me nyama na mo kan kra me ni sister can me so ni ti atwe hu enye wa wo kan na do you understand so enti nyama ni bu haya na at the policy level so nyama we I hope say bia this video will get to the right people mo be to me ehu na school no dey ye dey by say solve societal problems dey mebu wo ho a omo fa mekeka ho mai emmoa opia na emmoa nkwara no so me nye na kranka minim say wo ye stroke patient or something in them come so
and one thing is also ne omo epilepsy omo channel the way you handle omo from or very in the catch the mighty for Shannon. Oh, all these things, we we found it in our communities. So now ambulances around. Thinkers of nation, no. They say we realize our problem. Say you a Finland high. A cleanliness, one of the main service industry now. Enti Obiko School, University, Kobo bachelor's degree in facility and management. This is their target. Yeah, Ghana so thinkers now. You won't say, okay, we don't have these resources. Enti nonka ye chira yankura yina the kind curriculum hoa and at least community kitwe biya no. SS wo think obi akọ school up to the SS level now. Ka first aid in kakra de owo bi. Yenua ba Mrs. Adeyebo a eka car bebo ho na first aid kit kra enim. U-turn bus kese have a lot of passengers. Once a accident, you need face say that you keep two every crowd plaster cramp, you had to better a crucial and sana, yes, so mongu a came. We don't have them. And when these cars now they go for Ekoji road where they are now also. Yeah, I think sir, car station. You walk to the DVLA office now. All these things are public health issues. People think say it is just GPRT for us, but no. Car take about maybe 50 people traveling at a time. At least you have to make something available.
You see, say, it will even shock you. Say, you, when you drivers in Libya, just ask them how are acquire driving licenses. You go back and say, well, be driving and end driving mount. And then each of them, if you are on the cost. No, because nipa no go to car and go, oh, office on our driving man. How do you do that? Eben, do you understand?
Yeah.
All right, I'm coming. Can I come in a little bit?
Yeah, come
back to the health thing I can. My main focus is after even training them. No, so you be once a bro train every 3 months to 6 months, so they still review it. And once they be away, they still let you performing, and somebody will mark you that you pass it. So even yeah, they can't call it Hana say BB Krana hospital. It's a hospital need the at least anchor from sorry to say cleaner to the doctors. Everybody has to know. But Ghana, I have few people I have questioned them about this. So we thought about it, but we don't really do the practical aspects. And as I first say that, you know, especially the CPR. So one year practical, I'm telling you, you can write it, which might throw BBI explaining, but you do need and now one practice, yeah. Because compression, because now me can say here, now me can say here. But when you do it and the person is there teaching you where you have to push it and nina ebeboa. Indeed, it was every 3 to 6 months be or more review. Na or more iodine or my could you believe so be was scar, but all because you need some machine as in case of emergencies, they will be crying your CPR, then they can put it on you and then they click on the machine. So if it starts pumping, then the person can come alive. They do it 3 times. If you not, boom, then you are gone. Obi was scar, but all because we don't know. Obi but we don't know. So if you start telling them, they can buy it and put it in their car. And in case of emergency, and also how to use that. Not the shisha no one click it, boom, then you come back to life if you are not really dead. But so that's what I'm so coming back.
Simple
yeah.
We
say Hano say Obi Ohana CPR no ya anya ne ntem a ukodu hospital that's the first thing we use.
Yeah.
The first thing we use. Nti ene de aka unu wonya nkopon. Nti and ye 1 2 na say am fa de ana ye hu say but maye ni nyina kra wi na anya that's the machine we use. Na I said at least people come back life, then we take it from there. Ghana as scaffold bebre we can buy even a scaffold cry. It's a group bebre, but we can buy one for each school. Even the whole so if you buy one for each, we'll buy one. May show the Ghana hospital you will be you know one problem? We are hiding it until MP or DCE or somebody important, excuse me to say, everybody is important, but Ghana is different. Comes there before they will use it. Yeah, when you many people have central service for spy. All because they didn't even bring them out for us to use it. They are saving it. The same thing school now. Your teacher need you keep books because I'm trying to use a better thing. And at the end, I'm trying to pass it whatever level. Oh, man, you should starting at the end of the equipment. I'm telling you, they have it when you go to central service. Ghana, they have it there. but they will not bring it up because you use a better. Could you imagine, say, that you just ato niema koche ye krom, whichever chrome will free and people will agree to this, they will not use it. We be say, oh, you use a better. You use a better and they go. Into what about cano, one I just said, wow. Into some mentality, I didn't see the abamun news, say a man at the buy, someone at Tobachem. News when it's getting finished is the central service responsibility. Half of it, no more air refill. No more. No money expire echo. Also not ye new suye. I am so sad. Let's start from here so that we can start using it and stop hoarding it.
Yeah.
Now I expand it to a good. That's okay.
Yeah.
That's the one major problem we have in Ghana.
Yeah.
We don't want to use new things because it will gonna get finished.
Say niema no ba na nipa and I say workers at hospital no omo yusu. Ena politicians no so no. Say mobo modern si hospital bi ma ekro bi so a say a cheap compound o say a clinical say a den. If it is just a building, it's as good as 4 walls and P1 and P2 for common ekosua 1 2 3. What makes hospital is not actually because COVID-19 by who say like France military setting up hospital in the field within 2 minutes on the tent. But the machines now necessary a tent in one. And then a matter more than the buildings. So the politicians can spare us. I've built this buildings, that building, that hospitals. I'm making sure so what is inside it, you know, as severe, yes, romo. Omo nyanasa my ena too. Ye nipa na yeti my anymore so no. Things that we also have a responsibility be. Advance nipa no said the old kind. Scaffold and answer be scawe be munsem ekakra. Blood pressure machine crampono. What to be or a hypertension. You can be tracking your blood pressure from a time to time. Over call a hospital, at least with me, I provided information via a doctor. Ama with me, after and tentem. Not me what experience, Biso Swanka, me maya ashe. Who mentioned something about your stool? Maybe taking the sample before a treatment and then after a treatment to compare it to see the efficacy and also the effect of the treatment now, the amount. And maybe it doesn't go in that way. I have an experience of a music student at the University of Education, Winnipeg. Emrebia Obeko a hospital biano. Doctors diagnosed him with an autoimmune disease. Meanwhile, he was suffering from a hepatitis B. Until say WHO and some partners came around to do free screening on hepatitis B and or test a positive. And even at that, he had an advice from or non enough of nurses, doctors, and an advice saying on what to do, where to go, before he could know, say, actually there is treatment for hepatitis B. Once a Ghana society, no hepatitis B, I say, you sign it or death warrant, and no. So people who go to hospital who have typhoid, almost no obia or a malaria sign call.
Exactly.
Hepatitis B, malaria, sign coffee. So, some name we much what this I when you have a diner, body think of experience.
Yeah, I have experience. I have experience with typhoid fever. The doctor said semi malaria, and I treated malaria not long ago, so I knew it wasn't. It's Miami Koye lab. I'm fibro. I was negative. So I went back and said, okay, I'm negative. What should I do? Because me treating not long ago, and ain't me as close by when female. So I went back to the lab Now I'm saying let them don't have a full scan of my urine. To ammonia just complete a sample check. Typhoid fever positive. And I may call pharmacy, told me I'm drugs, and I started treating myself. And see, that's the thing. I think now Francis can say everything is.
Macho, who go through some experience we not we already now your nurse and answer before so.
I was a nursing student.
Okay.
Yeah, I was a nursing student then. But me say I said, Francis can say everything is too central. Yeah, doing now too central. Everything has go to a policy. We are a hospital. In Tinipan hypertension for 20 years now. Only the range of hypertension is it 100/60 to 140/90. That is the range. Only the another year. Oh, another year. A cost of crown. A cost of a saying. So we shouldn't centralize ourselves and our knowledge is power. And to say, oh, knowledge, no, check it. When you say 130 over something, no one say, this will be the blood sugar or Fedro. When you could do hospital, oh, I need to be crying out, check it. Now, one could do hospital, no medrone, but squan a co for the next minute, over to me, I day, I charge it. Because a cough form too much. Also, so I will send no medrone, say, and answer when you say, form. But if you know the range of, okay, this is the blood sugar range, it's air form too much now, like 2.0 now that's so 2.0 you're supposed to what rush to the no also did something sugarish and that's how we did it when a man now we'll check it here so checking here could do some stone and you get to the hospital say this is the range and I say now into the end I may have home but nipa no nene area be where for 20 something good years but onim bibia fa ho ne ma any now of form and the last me kind and I will say it again to say internet and no say Instagram Facebook Snapchat and kwan ne didi ho asem una na enti arabia sia busano o moja broso ne brof within the same esiche yare e brof within the same obi adwen se esiche ya se esiche won ayi e fa ba bi e no kre but e fa ba bi so enye enti busano ho e de na menye fa ho no akenka kire na maame abafu internet for say you se say ya e ofom e wo say e wo soro o esiche ya na nje se esiche on sabe bra wonum no quality ma esiche ne de ekọ kese wo body mu enti ye yini na so central say what about hospital for just 50 Ghana hene ye yini say hospital near very rare until once in 3 months once in 1 month no hospital time e wo confanote so intereswa enye ho na doctor ne ko kenkan akire we say eduane say nobody no ama example aha say broni kono they give them leaflet no do yama ni panekra no or the beden one could turn to baby and see we should decentralize our brain and our information jai Snapchat ne say we anyway a beef you or net so any near dimike back in kaya sa hey girl wait slay queen say like it's that time no so see fine ye una na be take us na maybe we are na and found sendness ni kwanti if you know your say me call ya that time no me say I don't have the symptoms me am hwa ye cry if me ma me kwa na ka share me say ana won ye ada onye nurse ni o na so okay ma me nkoye along last I was tested positive for typhoid fever me treating we no when I went back like me sakopo before and me consult here when I went back I was negative after just a short while hepatitis inflammation of the liver these are things that say uti asemase a eya na enye hu yaribu ha ya bonu because unti ase na say ukwa no be tell say oh hepatitis is just inflammation of the liver and ya boni kese san and easy like unim say me ya we say net you say nsa be apio na me nom ne kora me jaya me say enye esite enye yi nko a eduane nko a enye sugar nko a apio na me nom no yi we say even ubenku na wo mani dokun wo mani si wo mani ferment no a wo hu so pese obo no kora ti me ye e mani ko ha to these are decentralizing our brain anyhow our understanding is that your health, your health is your own responsibility. And your nurse need ya, and your doctor need ya. Oh, nkwana o adie. Ti wo sa de we a e ma wa hu se wani nda obi so. Ukope wa nkasa health yi na aboa ma edwuma no so aye ya ma ye nurses so.
Yeah, that was very educated. Last week, say either say Francis and I say Obi can say what our youth in Ghana no are interested in our internet no so no. Yeah, and it's okay to go there to everybody follows gossip of the day, the talk of the town, but sometimes no so no. Yeah, even cry we talk say students cry it to me and they say a YouTube. I think that's a Oko school where her lecturer will find some nice videos on YouTube, play it in lecture halls, and then now or not add something like this. And there are a lot of them. You can Google diseases and medication. Even medication now, medicine be about to free drugstore be paper shim. And the paper no side effects be one say a drew time be it was say doctor and a nurse. It me control say a drew ya won't say who say ni to America Sambra. But because of nurse patient ratio and a doctor patient ratio where your chrome so hard and they rush patients through into your moon is at time or prescribe what drove be more now to a paper shim read ye honka crack. Say a draw ya me ye a beboa me ABC the name mum it made in sans will be bremia a bit me ahame. Na no me hu sa e was me to America sign call a hospital. Ni na was sa paper no. We can be reading and we can spend our data on learning something kakra. And yeah, all the time. And videos like this, and also so no, you can share it, you can take part in it, and then we can educate ourselves. And a 7S.
You have somebody on the line.
To audio. We are waiting for. Yeah, and a 7S is connecting. It's still a way. I also want to share one COVID-19 a survivor. Or say, oko tema general a hospital, nani home fan no, but nani temperature na I say a kosoro into omama no stand there aside omu take no me temperature a kakra any na you okay, but the mama no echo fie omu taking the samples. So I'll say the following day, Thursday, I received a strange call. The gentleman told me that they took my sample and found out that I am COVID-19 positive. In fact, it wasn't easy for me. I tried to control myself. He said the doctor told him to isolate from the rest of the family. Then he said, he informed me that an ambulance will come and pick him to the hospital. However, the ambulance did not arrive until Saturday at about 5 p.m. And you know, COVID-19 no, achino. Na ono him say he never thought say COVID-19 until Wednesday, and he had taken a sample. Thursday, and your friend a catch and say we are positive until no they atwe ho free family ho ekakra. Na ambulance beba be foul. Until Thursday no ama Friday ama Saturday 5 p.m. and sana ambulance eba ba. Obi na share the experience like this. What can you say about this experience? Francis, you shall say also
Yeah, maybe. Iti wohwɛ this scenario a wɔde ama yi a ɛkyerɛ sɛ nipa no ɔbɛspread ade no koraa waspread yi o waspread it nti yɛkeka no nyinaa no yɛkeka de ma the system, the kind of health system na yɛwɔ no. And I don't know say bi a saa time na ɔte fie no ɔmo nika ka kyerɛ no sɛ wɔanya COVID no.
Yeah.
Wednesday no ɔmo ka kyerɛ no, and then
Wednesday no ɔmo take a sample. The ɔkɔ fie no the next day ɛna ɔmo friend ka kyerɛ no sɛ ɔyɛ positive.
That was Thursday.
Yes.
Ɛna ɔmo bɛfa no Sunday.
Saturday 5 p.m.
Saturday, were they sending medications?
The ɔmo ka kyerɛ no sɛ ɔntwe ne ho mfiri the family.
The family home.
Yeah.
And they other things. Yeah. I think say at least a better system like that. He be to me a confining them. And as I said, nanka be a police no aye fuller and castone a bit me find a different means I bit me the nedro a mano a brow isolation near the nedro a mano our tiki. It be all these things no ye can no a system so sending yasha neoma going forward no see who say your health no because a healthy population a wealthy population. So ahoɔden a ɛna wotumi kɔ akɔyɛ adwuma. So nti yɛn nyinaa yɛ mmoa sɛ yɛyɛ leaders yɛn nso ayɛyɛ citizens no ɔsɛ yɛn nyinaa yɛboa na yɛtumi ɛboa na systems no yɛyi. Yɛde insurance aba obi wɔ hɔ a ɔabuse insurance no just like that. Ɔabuse no health facilities nso bi abuse no. So ɔmo mpo a ɔmo yɛ leaders in the insurance system no abuse no. Until you find people in the insurance offices and nkɔfo a ɔmo wɔ health facilities no bi, then they dupe the system. So at the end of the day no na ade na kwa na ba ambulance no bi anka government do me ato bɛyɛ 2 for every district, but pilfering getting bi na nneɛma nketinketi bi ɛyɛ no ya corrupt system no nti ne atɔ 1. So that wasn't the best. He nya almost so perspective and get ready. Didn't na almost so it me a buy. So that time maybe na for all you know no almost some kofa on Friday or some kofa on Thursday. Yashishi will be so by Monday. I kofa on Thursday. So it all comes to the system. Say in ebe buania system ni. That's me.
Okay. Remember in your mama Ashton say maybe if they have an experience about how you see treaty obiaya what tested a positive. Now me answer and Becca sana me besides say ambulance na any available. Couldn't they have other arrangements? Kabi on Becca say onwa emra. And I say, be ni pano kasa or car on drive and I say some other way because most people in Ghana no the way our family no be isolating yourself at home no a problematic ekakra. Pacho yenwa ba dan na beka.
Pacho maybe that first ni pano na or symptoms and na ehano like or general symptoms and answer na home fano because COVID-19 being positive for COVID-19 doesn't mean you should be in the hospital.
Yeah.
When you are being tested positive or when you are being suspected and I say you are being in contact with someone who will be I say you better just stay at home. Obia stand I positive one go hospital that by the
yeah.
And COVID-19 is something that you treat symptomatically. Also, disease or so what's the drug's name?
Hydrochloroquine.
Chloroquine waiting me abwa. Ebi mo say it's still on a fight. Ebi mo say not true. Ebi mo say true. Because doctors will be for 4 days. I say ebi tima sayare ebi so are debunking the rumors. we don't even know if it is sobolo. We are no sobolo SARS when you be. Because you know Ghana, you know sobolo SARS, so say about me binti. We don't know. Obi wo was one day obi so the banet say o boiling so no de anke chade lemon gum ano o prue eko. So the rumors will be there, but the thing is testing positive, being in contact or having symptoms, and not just say you have to go to the hospital. Ghana and say I'm a phone hospital your death sentence. The best thing is that you get ubetibi actually went for Owusu-Afriyie home. So being in one room and staying there and you de-stress. Stress is something the number one killer. The same symptoms. The only stress nipa do be first. Stress is like the root of all most diseases. Yes, so hey, be an ultimate stress. If you hypertension, diabetes, you was stress related causes. And I'm so knowledge about the diseases now. And yes, you always been based on what the doctor be can or who better her country. Nipa no so only big symptoms you don't need to even go to the hospital. What's nephew teeth say treating the flu symptoms. Or when you're on para more than 3 grams a day. Into one non-parano and a pabi and one muti was stressful that who gets my talk cry sana what hospital because as I said a confidence my husband is obi dear annual saying obi there because obi anya bia we had a case nipa no or yes suspected and they didn't call hospital so I now abandon phone no go to the same room but there were different beds. Sorry. The same room, but different beds with another person, or testing negative. The other person tested positive. And I'm seeing people tested positive. They were saying room, almost checking beam. At long last, of course, tested positive. Or no one crab a shredding quack. And money panel yet alive now. You see how it is. And Obia or how I see yen or hunty. Young fans was it, and yet positive doesn't mean have to be at the hospital. Ama only if say mini pan a busi fie maybe ya nim say Ghana ye ho chie kakra na busi ni na egudan ba akum social distance ko en wo hen fa ko she cupboard mu enye ye enti no de at once by force and as a kitchen bi kwa na wo akwashi honum de a no na metima ka say bi anu nti ana obi obetima rush even the hakwa no say if you can't do social distancing but at once by force say you are positive or say they will call.
Yeah, that was it. Mrs. Sabeye boy. What we become fat sa experience with one and I am young queen.
More common because I think that and they've said a lot, so let's move on due to the time.
All right, okay. So my concern ekakra that aspect and say promising the person to say what the ambulance will have a father it take 2 days no. Be assessing the situation no. Na ohia say obewo a hospital. So you advise that person accordingly. Yeah. You can even do self-assessment to be online to assess what symptoms what is going on. You know, when a computer being command if we follow within this range, they are free. And offer nipa no line also no. He is going to advise you and says, okay, and you need to test and answer your referral to a testing center near test anyway. So there is a procedure, but assuring the person, say, we are sending ambulance, there was something amiss.
Eben, I think all this goes to public education now, so if we educate public about this, it won't be problem. So to me, all this has to start with educating people to know what to do. Check your temperature, do this, do that, call this. I think that it will be okay.
Oh, yeah, no, correct. Why are they? I think say, and that is why we are doing Sabie Ekakray. I have been saying it says one person crying for 8 years. It's something. It took only 12 apostles of Jesus for Christianity to go that wide. As I say, afar seeing. So I think say somebody will be educated. Now we are advising say Ghana so say asempano I will say etre. I have a lot of experiences that we could share from healthcare workers and from patients alike. But I think say yemre no I a bit a kakreya yakaye you know yede ebe so ha. Maybe the next time we will be discussing lessons of my Ghana yesuya from a COVID-19. It is teaching us a lot of lessons in an economic sense, in a health sense, in our education sense, but we just care about public health matters. So if we will look at the lessons yesuya free COVID-19 a pandemic but answer na yebeko yebema obia ama the closing remarks kakra why na the message ade yeboa na o kasa wie kra na say you want to give attention to our beautiful little one. You can give attention to her. Every patch wait me
okay, that's it. Okay, I did cry mechanic say try as much say and do ne mom ye be koso na ne ye ka be yetime tu ho anamo na minim say utu ho anamo a ene be ma ne ye kan atimi aye adwuma because say ye ka ne ye ntimi antu ho anamo dia na ndie ya be kasa ma ye mre no aye kwa ana say nti me de kakra meka ne say ne ye koso be nyina no ho me ye hyase ne ye ntu ho anamo ye say nipa ba ko hyase so wo hospital bi na wo hyase say people will start to hate you. Say, oh, you're too no, the whole Ghana, don't be discouraged about that. Because taking because there's competition here, because everything is privatized. There's a competition. But Ghana no but say then we continue and say no. Say if the system is working, so your administrator be administrator and straighter. People follow suit. But when the administrator is like, oh, that is the problem. So if you change the mindset of Mebetoye and then you want to move forward and do what is right, I think say Ghana can be something in future. Thank you.
Okay, that's it. You have do you have another person in your family who also want to contribute, Anna? And I say we should
okay, I'll see next time.
Okay, because you have twice there.
Jose.
You have appeared twice. There is Mrs. There is Adeyabo family and Mrs. Adeyabo. So there was somebody.
I see I will PA and Nyamiya Adoma next time. Next program then he can join.
Okay.
I told her to get one of these, but she didn't. Now maybe keep your.
Hello. Yes, Francis.
Yeah. Amen. Yeah, ebi the mesoma kind of say going forward no. Yɛn nyinaa yɛhu sɛ enimpa nkwa no ehia paa because wohwɛ the massive change a aba wiase a ɛne the inventions a aba wiase a enipa baako bi mu so abɛyɛ saa de no na aboa yɛn nyinaa. Sɛ yɛhu enipa life in that perspective a, I think sɛ we will take every step possible sɛ yɛbɛtumi abɔ nipa life ho ban. That will be the central point to creating better systems, efficient ones, effective ones, systems a ɛbɛtumi aboa na yɛtumi maximize the kind of health resources a yɛwɔ na mpo yɛasan so tumi de ebi aka ho ma aboa yɛ na yɛtumi raise the standard of healthcare in our country. We should also eschew corruption and then those nneɛma nketenkete bi na nketenkete nso yɛ akɛseɛ paa in the long run no together no ɛhanteɛ in realizing or achieving better health system for our people. Yeah, and that's it.
Yeah, that was it. You're not in your bad buying on a summer closing remarks. But before that, no, you acknowledge say very more. So I join in into a very more so you have more chance ama or experience be an answer or comments be so they are not you have call you in your bad buying.
And that's your Patrol the maker cracked also and say I'm still pro decentralized. Yem jaya reni adisha obi bakum. Obi ni resha aban so mbebwan. Inti se Brother Francis Kai. Why papai? Ye be money buogu so a ye twan aban so be ye. Inti nipa won kwa when the Francis pipe ne kwa the way ye won kwa. Inti won kwa so ade ehia nipa won ni kwa na woni hwe. O health na ya ade so ye mu. Inti se ye pre-bibia na no na wo say first person ade a ye dey first na ye hwe. Inti se ye money much important to us a ye be hwa kwan a ye be fa so ye dey aboa ma ye nkwa na ye dey ahoanya ahoden na etima me etima ye bibia ye ukọ sika upanyina no se ene uyare ana ufiri ma e wo henfa ugu a unfa nko enti me se ye decentralize ya adwen no ye fa ye nyina nhye se o nurse ni be doctor ni de o kani ye hwehwe na Ghana so ye ngbobo ye ho se ye he nua no mo teka mo ye e bia computer science ana ye o betima ye app bia e betima ka bibi se se moja broso na nkomofo no mo many apps India for many apps cover diseases. It is so they send a Bible a king kind and some wo mu. Ye betima ye be soon develop some app be a can about health. Moja broso a Arabia be a brofocasa and a putocasa a can say hypertension. Say na ye, a janisa ni say no dear. Na obiti gunin nina na cra phone so na would see. And answer program be a betima educate me a share what you want than say gossip ning juana a beboa me at a yari no ho. I'm yenya enkwa anya bruso. The nipa won't qua no idea. Thank you.
Yeah, that was it. Very more. The patrol say over to me akasa.
Charlie, me joining very late into I don't know what you are talking about. I just joined, so I heard you talking. I did not even hear you talking. I saw Francis and Diana talking. I just joined. So
Okay. We have been talking about experiences at Yenya war your hospitals. And as I say nurses, doctors let me share more experience. Now patients also to me share experience. And as a systems are also your health system, you know, how are affected ye as a patient. Say you home command to the over to you know. Now
okay.
a closing a remarks. I don't know, say what experience be a what famwa Ghana as a patient or near be share no afa so a 2 year for a kakra bi a be ma bi a 2 minutes bi na oni yakasa se wo bi okay I think say any connection no internet connection no hard kakra. So in a concluding no, we say the majority of patients have no knowledge on their rights. They they are abused and do not know of any steps to follow to get their complaints addressed. They do not complain when their rights are violated. Due to low level of knowledge on their rights as patients, they do not insist on anything but comply with whatever the health worker instructs them to do. So, Sadia Mrs. Adeyeboa can say she acted something. She asked something. Until you good say, ye nyina no, ye betumi asua bibi ekakra. Na mom ukodru a hospital so. Na say healthcare professionals, nurses no so echro e bibi so a. And yeah, always now also when you're more a struggle, I think say who are they are there to help you to survive. Ne do time so now when I say all right, and also so omo ebuswa. They are by all means complaint structures are within healthcare facilities bia obetimi aka awa asem na komodia yedi nei e patcher say wank sankasa ma wakoma enko wapomuden ho. When you need to walk in a short distance bia walk, don't just jump on a trot a taxi sa nanti kakra ye exercise e kakra edidiye no monsuo ekese edru time bia we ska obetimi dia top blood pressure machine to be e kakra nafa check o blood pressure e kakra na eni nyina no ebe boa eye nyina enkomodi a ye die ye butaye any public health matters say apomuden ye nyina niema eha ye nyina no e wo say ye tai di e ho nkomo na wohu na mihu na ye cha ebe boa eye nyina wo hwe video yi so a share ema unua na onhwe bi na ono so share ema eninua. Let's begin and continue to talk about public health matters. Our next topic, we are going to discuss lessons learned from COVID-19 experience. Yada yenua mo omo join ye na ase. Yada omo so a omo beka ye ho. Tie ye ewo Facebook so asa ase. Yada yenua Francis ase. Very more yenua Dina ena yenua Mrs. Ade Yeboa. Nyame inshira emu nyina se mama bye.